Hello, welcome to Medical Consulting Group. I'm Bill Rayburn, founder and one of the managing principals.
I'm Rob McCarville. I'm a managing principal here at Medical Consulting Group.
Hi, I'm Steve Shepard, and I'm a managing principal.
I'm Erin Malloy. I'm one of the principals here at Medical Consulting Group.
Medical Consulting Group was founded really in 1989. Although we changed our name in 1995, our mission was the same, to provide business solutions to the medical industry. There are 6 distinct departments: consulting, medical marketing, ambulatory surgical center development, management services, coding and reimbursement, and revenue cycle management. We provide business solutions to medical practices, ambulatory surgical centers, and medical corporations.
At MCG, we have a team of consultants that have various skill sets. We're involved to a great degree in consulting at the practice level, both from strategic planning, marketing, practice growth strategies, and other merger and acquisition activities, practice valuations. We also do valuations of ambulatory surgery centers. Our nurses remain involved with clinical directors to deal with regulatory changes and clinical questions that arise from time to time. So there's very little, particularly in the ophthalmology space, that we don't handle.
When we first started Medical Consulting Group, our marketing and creative services team was pretty small. We used traditional media to educate the public, whether that was television or radio or newsprint, even direct mail. Today, that's changed significantly with digital platforms. We now have people that do websites. We now have people to do social media. We now have people that are writing all those materials in a very specific manner in which marries well with the algorithms used for some of the digital platforms like Google and Yahoo and Bing and Facebook. In addition to that, we have graphic designers and videography and photography that is really an important part of our creative services today, and again, very important in educating patients about procedures. In addition to that, we have media buying services for traditional media. That's changed significantly. You used to be able to buy just the major channels of ABC, CBS, and NBC. We now have a number of stations that are available, and the way you purchase that is very different today than the way we purchased that years ago. So of all of our departments, I would say creative services has changed significantly.
Here at MCG, we have a core team of individuals that provide all of the services ASC development clients could need. We start out doing a deep dive into the financial feasibility of the project. Assuming it proves to be feasible, we move forward into a mode where we're working with architects, engineers, and general contractors, providing information about items in the development that have structural significance and design significance. After that, we have a team of 3 registered nurses that specialize really in the regulatory compliance.
And then through the construction, they're very involved with design elements, operational elements, how those are impacted by the design of a surgery center, and then bringing on that initial clinical director that's going to be that lead nurse in that surgery center. Our nurse consultants work with that person, training them, getting them ready for survey.
And our contract isn't really complete until the client's Medicare certified.
Medical Consulting Group has fortunately continued to grow with its de novo ASC projects. We've now developed over 90 centers over the course of our history.
Steve's very proud of the one in Canada that he did. But last count, I think we had projects across all the surgical specialties.
We have a management services group that will do really two things. One, we can manage a practice or we can manage an ambulatory surgical center. So what's needed in order to do that? Well, first of all, we need a consultant that is going to be at the practice, working in the practice or the surgery center on a regular basis. But in addition to that, we've got a great group of accountants here that actually will do general ledger accounting for that facility. So they'll actually be the people that will manage the money process of paying, collecting, and making sure that it is a profitable operation.
IT services are another integral piece, setting up the networking. That could be phone, internet, all of the hardware that goes into a surgery center, the software, ensuring everything is working properly. HR support is another component. So again, we have our HR team that will set up the initial benefits, provide the payroll services, and then again, manage ongoing updates, annual reviews of the benefits, soliciting bids.
So again, the doctor or the doctors can treat patients and not worry about the day-to-day business functions that they, one, weren't trained well for, and secondly, they don't really want to do because they want to keep their focus on taking care of patients.
Corcoran Consulting Group is a subsidiary of Medical Consulting Group. We work with ophthalmology and optometric practices, as well as ASCs and hospitals for eye care. We consult on issues pertaining to billing, compliance, and reimbursement.
So interestingly, we work only with ophthalmology and optometry. So a little hospital and ASC work, but only where their eye care is concerned. And really just try to navigate the whole reimbursement arena for our clients.
Our goal is to work in conjunction with the practice staff to kind of be a resource for them. So we assist clients by performing audits, either compliance audits that the practice actually requests, or to assist the clients with audits that are actually being done by payers.
We do training for our clients, physicians and staff. We offer some services like fee schedule analyses, webinars. So we really do try to assist them in a variety of ways.
We are national, so we see clients all over the United States. Anywhere you are, we will be there.
RCM stands for Revenue Cycle Management, and really that started out of the need for our surgery center clients that we had been developing, now needing ongoing support. The complexity, especially of a multi-specialty surgery center, the complexity of joint venture surgery centers with hospitals and surgeons, all attribute to the need to have an outside partner that can help manage that surgery center effectively.
Oftentimes when we're talking with clients, they're trying to figure out how to make more money without adding a ton of expense or adding new providers. They will look to us to say, am I getting all I can get with what I'm already currently doing? And so that kind of lends itself to grow the revenue cycle business, because we can say, well, who's currently doing your billing function for you? And maybe that's something that we can help with to ensure that you're collecting as much as you can with what you're already doing. We will work with ambulatory surgery centers as well as practices from the get-go. So once the surgery or the patient visit has completed, we will code the claims, scrub the charges, get the claim out the door to Medicare or the insurance company, follow up on the claim to ensure it's processed and paid. We'll work with the patients on any balances transferred over to them if they need to set up a payment plan, or if they're not able to make payment and we get to the point where it needs to be turned over to collections.
We've worked with Medical Consulting Group for decades, probably since the early 1990s, and they actually put together our current practice for us. We had 3 doctors in one practice, 1 doctor in another practice, needed a surgery center. They facilitated the purchase of a retiring doctor's practice and his ASC, talked us through the licensing process, talked us through the staffing process, and the consultants, several of them actually, worked through the marketing branding with us, worked through the design elements with us, and helped us learn how to run an ASC efficiently. You can have consultants all over the country doing all kinds of different things, but to have a consulting group that works just with ophthalmology, they have really seen best practices East Coast, West Coast, Midwest, North, South, all around the country. And while we may be in a different medical environment in our city than in some other cities, they've seen enough to know what works. They provided a lot of different services for us, marketing materials that we use both for our patients, for our referring doctors, video for our TV ads, and for promotional material on our website. We've been very pleased, and we'll continue to work with Medical Consulting Group for a long time.
What is the best asset that Medical Consulting Group has? It's people. We have great people. We have been able to attract great people.
There's been a lot of growth since when I started in 2009. When I started, there was around 20 to 25 employees with MCG. I've seen some faces come around, and it's been exciting to be part of that growth.
This organization would not have grown to what it is today and will not continue to grow without great people. I think we have hardworking Midwest ethics, we have good standards, we have great facilities. You combine all those things together and we have a very successful business.